Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, we will be discussing social prescribing in community health centres ahead of the Alliance for Healthier Communities virtual Social Prescribing Conference this Thursday, October 20th. To give a full scope around this topic and the conference, I am joined by Natasha Beaudin from the Alliance for Healthier Communities, Abby Richter, Registered Dietitian and Seed Program Lead at Guelph Community Health Centre, and Albesa Aliu, Health Promoter and Project Coordinator at Rexdale Community Health Centre. How are the three of you doing today?
Doing good.
Wonderful. Glad to hear it. So to start, I will start with you, Abby, because we have yet to feature Guelph Community Health Centre in a podcast episode, although we did make a support community health centres video about Guelph. Could you remind our audience and our community, remind our audience about your community health centre, the community you serve, and the programs offered?
Of course. I do really love that video. Every once in a while, I'll watch it to make myself feel better. So we support residents of Guelph who are experiencing barriers to health and well-being. For example, people who are structurally and systematically discriminated against, people who experience houselessness, substance use disorders, newcomers to Canada, refugees, but really anybody who's experiencing barriers to reaching their health and well-being goals. We help them at the Guelph CHC. We have consumption and treatment services on site. We have a safer supply program. We were really involved in a new permanent supportive housing project that just started getting built in Guelph. We have early on programming. We breastfeed and chest feed programs. And then, of course, we have primary health care with dietitians, social workers, health guides that help connect people to services. And then I work on the SEED team, which is a food access site in Guelph that's kind of incubated within the health center. And we provide food access services. So our biggest venture right now is an online grocery store that is geared to income. It's on a sliding membership scale, and it's also a social enterprise. So folks who can afford to pay full price for groceries, they can do that, and then that offsets the price of food for people who need to pay less. We also do gardening and farming projects. We have food and nutrition programming, and then I run a fresh food prescription program, which we're going to talk about a little bit more in detail later today and also on the 20th. And then we, overarching, we have programs where we employ people with barriers to employment. And we also have this amazing good food distribution program where we're able to buy surplus food and redistribute it to other food access providers in Guelph, because we have the infrastructure to make that happen really easily. And we also have a food surplus distribution program, which is really exciting with Second Harvest. So we're using high quality surplus food and giving it to people who want it. So lots going on in Guelph.
That's amazing, and a lot of innovation that, in all honesty, I mean, there's so many community health centers I try to support, but that I was not aware of. And I think that's super interesting. Mm-hmm. I've had the honor of featuring Rexdale Community Health Centre before for Pride, our Pride episode, which I was very happy to be able to do this year. But Albesa, could you also remind our listeners about some of the Rexdale's programs offered in the community that you serve here in Toronto?
Well, thank you so much. That's great to hear that we had Rexdale shown during Pride Month. So here at Rexdale Community Health Centre, we serve clients that are in North Etobicoke, so this part of the city of Toronto. Our doors are open to support and advocate for physical, economic, social, and mental health, generally well-being of our diverse community. So what's really great about our work is that we're working with community partners, and all of this we do to really improve the quality care and the services that we have for a diverse population. In terms of services, there's a lot going on here at the Community Health Centre. So we have primary care, so clinical services that are offered through a team of physicians, nurse practitioners, nurses, dietitians, social workers, a physiotherapist. And what is also really great is that in collaboration with the City of Toronto, we also offer dental services. So in terms of primary care, this is one aspect of it. And then I work for the health promotion program that really is a large program that works on addressing social determinants of health by promoting healthy behaviors and really creating a supporting environment where we build capacities in our community. So as part of this program, we have programs for youth, we have programs for families, we have programs for seniors. There's a lot of different programs that go under this umbrella and different support that really at the end address social determinants of health, but also health equity issues. And so a lot of our programs look at removing these barriers as well. And then two other components are as well, we have the chronic disease management team that works on prevention and management of chronic disease. So this has to do a lot with client education and support for specific programs. And then we also have pathways to education that really helps to reduce school dropout, but also offers support to families and students. And it's been very successful. So there are a lot of all-encompassing services that we offer and a lot of very specific programs that work under these themes. And yeah, this is all the work that we really do to support our community here at North Etobicoke. And my work lands within the health promotion team, and that's where the social prescribing comes as well. And so I'll be happy to share more about this as we move on with the interview.
Yes, I'm really excited to hear more about that. Yes, Natasha.
Oh, I was just going to say that's where the magic happens, in the health promotion team.
Yes, that's what I'm hearing. That is where the magic happens. And Natasha, I'm very excited to have you on because you are the first provincial representative that we've had from a provincial association in the community health center world. Could you please inform our listeners about the Alliance for Healthier Communities and the work that you do with community health centers at the provincial level in Ontario?
Sure. So we're the member organization for team-based primary care in Ontario. So that includes community health centers like Guelph and Rexdale. It includes team-based family health teams, Indigenous health centers like the Aboriginal Health Access Centers, nurse practitioner-led clinics. Yeah, so we are the association. And one of the things that all of our members have in common is they're all committed to health equity. So when we talk about people who face more barriers, so we are all committed to reducing and eliminating those barriers. They all deliver comprehensive primary health care, and they are all community governed. So those would be the qualities that all of our member organizations share. And the Alliance, advocates for issues for these centers, tries to move some of those health equity goals forward, speaks up for populations that are not getting the services that they require, and continues to support and support the issues that those CHCs and other organizations are working on.
Absolutely. And one of the ways that you do this, of course, is through conferences and things like this that are going on this Thursday. So as we previously mentioned, you're hosting a conference about social prescribing, current practices, and community conversations. Natasha, I was wondering if you could explain a bit more about what we're talking about when we say social prescribing and what benefits it provides in improving health and healthcare.
Yeah, that's a great question. Maybe I'll just back up a little bit. So I'm relatively new to the Alliance. I've only been here for about 6 months. And previously I was a health promoter for many years at Centertown Community Health Centre. So I'm based in Ottawa. And that's why I keep doing shout outs for health promotion, because in my heart, I am a health promoter. That's my true nature, I think. And so just to go back to your question. So did you want to start off talking about social prescribing a little bit and breaking it down?
Sure. Yeah, it's definitely something that as someone new to the health center world as a whole, but not the nonprofit world, I had no idea what we were talking about at all. And so I've learned a lot just even in building quickly this podcast episode. So I would love to hear, from some more expert point of view, what social prescribing is. And then of course, what are the benefits it provides to our world as community health centers?
Sure. So I think we might all each have different definitions. The way I talk about social prescribing is it's connecting people with programs and services, non-clinical programs and services that support their health and well-being. So that could be if people are food insecure, they need a meal before anything else can happen related to their health, or people need homes, people need transportation, people need fresh air, people need visits to nature, arts, culture. Culture can be very important, like especially when we talk about different communities, like having access to food, to things from your own culture, not necessarily from the dominant culture, and physical activity, and even just social connection can be a great social prescription. So that would be my definition, but I wonder if my colleagues here have anything to add.
Feel free.
No, I think that you did a great job, Natasha. I was having a conversation with somebody recently that was talking about social prescribing, and they were focusing a lot on the social, like social as in being with others, which I found interesting because I had always thought about it kind of like social determinants of health and prescribing things that affect those, which can be social situations and reducing isolation. But I look at it more as those plus, structural needs or things like food, because I'm in food prescribing. And I think an important piece is that it is non-clinical programs and services, but some of that connection can happen and does happen in the primary care space. Which is interesting. And it's a nice link between doctors and the primary care team and community programs, which I think sometimes had been missing in the past.
Yes, and maybe to add to that, Abby, because I echo a lot of that, what you're sharing as well. Social prescribing here at Rexdale, the way it felt is that it really kind of links the different departments that we have within and all the work that we do as departments. So it's been really well received that way, because it has really served as a connector between our primary, between our health promotion department, chronic disease department. So, but also it's been nicely received by our providers as well, because there's a doctor seeing a client for a specific concern, and then it's really nice that they get to connect with all these other alternatives that the client can have to address other things that they've been talking about during that consultation. So yeah, and that way it's really, it brings together all the work that we do at the center, which is great for us as staff as well, but for the client too, to see all that they can really benefit from the services that we have. Yeah.
Yeah, I was just going to add, it's about asking a couple extra questions. So if you're a nurse diabetes educator and you're saying, okay, you have diabetes now, and now you have to change your diet, and you need to eat 5 servings of fruits and vegetables. Okay, we'll see you next week. But if you don't ask those questions, oh, are you able to access fruits and vegetables? Do you need some support? Oh, like you need to do your physical activity every day. But if you don't ask those questions, well, and then like just bringing into this, the social connection you mentioned, maybe it's a bit easier to do some physical activity in a walking group where you're connecting with others, rather than just like looking at your exercise list. I know, just speaking for myself, I find it easier to exercise with others. So, and I think that's a real strength of CHCs, is that we do ask those extra questions. We spend a little bit of extra time to get to know our clients and to find out what matters to them.
Absolutely. It sounds to me as the person a little bit from the outside that it adds to the wraparound care model. It isn't just about the clinical, the primary health. It is, we offer all of these things. So we will ask those additional questions because we can try to get these people those services or reduce the barriers. And I think that, like, which ties into my next question, and the reason that I came up with the question is the language sounds different, but it's really just about finding what are what are basic human needs, and how can we get those needs met for you in a way that is kind and compassionate, which to me has been the CHC experience since joining Catch. So I will lead into my next question, which is that it seems to me social prescribing is what this model has always been doing by connecting primary care to various programs and services. would you say, and I'll start with Albesa, is social prescribing another way of describing what community health centers do? And are there any particular new or added ways of organizing activities that build on the community health center model and further advance those goals?
That's a great question. Yes. So I think in some way it is. It's not like we are reinventing the wheel with a lot of the colleagues that are doing this work. When we talk, is that, oh, we've been doing this before in some ways, right? Because a lot of our works and programs are supportive of clients and really are non-clinical in nature, if we look at it that way. So in some ways it's the same. I think what's special about this is that it's very intentional and it's organized. It's organized and it's structured in a way that provides a clear pathway to offer these supports, provides a clear pathway to connect all these resources that may be already available in the community. For example, there may be these groups that offer walks, there may be this exercising programs, cultural programs that are out there, but you have a program that kind of creates a structure, to find the right word, that really brings them together in the form of a prescription, so that when the client comes and says that I have these interests, I have these needs, then you kind of have that list of prescriptions and you can take it from your bucket of resources that you have. And what's also great about this process, I think, is that you can kind of see, you can see the progress of the clients as well. And so they may come for one thing to speak to their doctor, and then they get this extra thing that is contributing to their well-being. And you can see this and you can track this and see how it's helping them. And just create all these connections in the way. So I think in that way, having this very specific structure and this really, this goal to support clients in this way is what makes it unique from all the separate programming that we do. And one strong part about it, I think, is that it really unites all these great things that we're doing.
Amazing. Abby, I know you're also Guelph Community Health Center. Is there anything you wanted to add? Because I see you nodding along so enthusiastically.
Yeah, Carrie, our health promoter, does a lot of the social prescribing. So could talk about this for a long time, but from my perspective, I agree with everything that you said. I think it's also, in a way, really different than what has previously been the dialogue with community health centers, because social prescribing really easily takes it off an individual's need to change or make the right decisions or choose healthier foods by showing that there's structural needs for people that aren't there. And now we have a dialogue that's really easily had with social prescribing, which helps. And also at our center, it's allowed us to have, a different structure to connecting people with programs and services. For example, we now have a community connector. So in the past, doctors would try their very best to connect people to services, but if they didn't have time, or an email forgot to be sent, or they couldn't connect with somebody again, our community connector can do that work of breaking down barriers to these specific programs. For example, her name's Kim, can call somebody and say, do you need transportation help? Do you have a mental health concern that we can provide supports for that can help you access this program better? And that infrastructure has been very important for the food prescribing work, because it's easy to say, I'm providing this service, it's a good service, we're providing people with food that need it, but there's still so many barriers just that are there systematically that service actually isn't inherently helpful for everybody if you don't have that extra bit of help that was provided through our social prescribing movement. And I think the organization piece is huge, organizing us into a movement. Because now, in Guelph, we want to expand food prescribing to people out or health centers outside of the CHC model that have less of this dialogue. Like social prescribing is a great fit for community health centers, but now with social prescribing, we can have this dialogue with other health centers that may not be like as, they might need to change their thinking a little bit about things, which social prescribing and the work we've done as health centers can really help us to do that, I think.
That sounds amazing. Natasha, did you have anything else you wanted to add as well as a response to that question?
Wow, we've just covered so much interesting ground. It's really got my wheels turning. I guess I'll speak to Centertown. Like, yes, the social prescribing was similar to the work our community development and health promotion team was doing. And what the social prescribing brought was really a lot of intention around it. So we had a clear referral pathway. We made it easy for our colleagues, especially our colleagues in primary care, to make those referrals. We had like the link worker role who could do the follow-up and have some of those longer conversations. So we actually found that it really increased referrals to our existing internal programs as well as our new social prescribing programs, because suddenly we had an easy way for our colleagues to make those referrals. Yeah, I have lots. I could say a lot. And also give it that feedback that you talked about. So it's one thing if I say, oh, you to a client, you seem kind of stressed out. Do you want to come to my stress reduction programs? They're like, who are you? But if they've been working with a provider, a nurse or a doctor for 10 years or 15 years or 20 years, like that could be some of the longest relationships in that client's life living downtown. And when the doctor says, my colleague Natasha runs this stress reduction program, I think it might be something that might work for you, then that gives a little bit of they know the clients, they're making good referrals because they know them well. And then that it comes from their provider gives a little gravitas to that referral. And then I'm able to, because we're tracking it through the EMR, it's not just an informal mention, oh, you should take this yoga program. It's like, we're tracking it, and then there can be feedback. And I can say, your client has attended all 8 sessions. And then the doctor can tell me, wow, we had annual checkup this year, and the anxiety is so dramatically reduced, and it made the checkup go smoother because we were able to stay on topic. And so then when you're able to communicate and share that feedback, it's awesome. And that's just one example,
No, that's an amazing example, and really like a very clear and concise way of saying like this is directly how it would impact and help the person, and having a whole team involved. And I think that's a really great for anyone listening to this who isn't in this world and wondering more about what the benefits are. That very perfect example. Abby, I'm very excited to hear about your concurrent session entitled Fresh Food Prescribing and what the community is saying, especially after you said all of that very interesting, innovative stuff about what's going on over in Guelph. Can you tell us more about some of the more in depth about the work that's going on, and a little bit about the concurrent session, if you can give any spoilers to what I'll get to hear on Thursday?
For sure. I'll start with maybe describing our program a little bit, because then it'll be easier to explain the session. But food prescribing started mostly out of the States, like after the social prescribing movement, but in the States, they started Wholesome Wave, which was a big food prescribing program. And we started a smaller scale program at Guelph right before the pandemic. It was 12 weeks. So people with chronic related or nutrition related chronic health concerns that were also food insecure could be prescribed food. And that looked like giving people vouchers that they could use at the Seed and our services. So at the time it was a market, now it's an online grocery store with the pandemic. And people can choose the fruits and vegetables that they get. And alongside that program, we're also doing a research study. So Dr. Matt Little from UVic is helping us with the research side of that. The 12-week program was a pre and post survey, mostly questions about people's health and well-being and how they felt about their health, which I think is very important. And then now we're just finishing a year-long food prescribing program. So very, very similar. Doctors, dietitians, social workers, even community workers. We were pretty loose with who could refer to the program. could refer clients with nutrition-related chronic health concerns and who were food insecure, and they received these vouchers for a year to buy fruits and vegetables online, and it got delivered to their house, which was a really important part of our program and unique to our food access service, because right there it takes out a lot of barriers to our program. And then we did a survey very similar to the pilot 12-week program. And then we also did blood work. So our clients are already getting blood work, some of them because of diabetes or high cholesterol or different reasons. So we were able to work with clients and our primary health care team to use the EMR, to the electronic medical record system, to work for our program. So we're analyzing that data. We're also doing very, very important qualitative interviews, because in terms of equity, that piece is like most important. Hearing our clients' stories about how they actually felt during the program is much more important to me and, to our community than the blood work and stuff. I think we need to do that to try and make change to policy and that sort of thing. But I just really want the community's story to come through versus just all those numbers. So what we're talking about in this session is how it really works well in primary care to have food prescribing, and the factors that and the facilitators that lead to success, but also some big things that we need to address when scaling and doing more food prescribing work, because there's still some equity concerns. People who don't use primary care in our community, we have a hard time reaching them. As a dietitian, I think we need to expand the products that people can get through food prescribing. It's not really fair. There's some equity issues with saying, you get money, but only for fruits and vegetables. So we're really, really trying hard to move that needle a little bit and open up the program to more fruit and vegetables. And there's some other, there's still barriers to our program that we need to help reduce and change the model, especially if we're going to be helping more people. So we're going to be talking about that in the concurrent session. We're going to link food prescribing to social prescribing and the pathway, and kind of show how it works at our center, how we fit food prescribing into the social prescribing model at the health center. We are going to hear from a community member, which is the best part of the presentation. And we asked some really important questions, like, would you rather, a really interesting part about food prescribing is when you think about it, you're like, and same with social prescribing in a way, should we just give people money? Because like food insecurity is an income-based issue. People need to get paid more. So we're in the qualitative data, we're asking people about if they'd rather just get cash. And surprisingly, anecdotally, we haven't done the analysis yet, but a lot of people are saying, no, I like being in the program and receiving the vouchers because there is this social aspect. I know that someone is looking out for me by referring me to this program. People are checking in at least 3 times a year, if not more. A lot of our community orders over the phone because of technology barriers. And so they're talking to people, weekly, which was really eye-opening because I was struggling. I was like, we're building this intervention that's really hard. There's a burden. People have to use our intervention in the way we've set it up. Would people just rather us, give them money? I don't think anybody would allow us to do that, but it's nice to know that people really like that social aspect. And I think that really speaks to the importance of social prescribing too. So yeah, come to the concurrent session. We have lots of things built in to get engagement from the audience. If people want to share about their health center and how they think it could work well or how they think it couldn't work well. I love to talk about it because it was a huge learning curve, and I want other health centers to just be able to do it quicker. for example, yeah, we'll talk about it in this session, but there's lots to talk about. Like funders really love to fund the food aspect and give you money for food, but as health promoters know and health center employees know, like it takes a lot of staff time to run programs that actually reduce barriers because everyone has such individual needs. That takes time and connection with people and phone calls, which is lovely, but it is difficult if the staff time isn't there. And then ultimately the programs suffer. So we are going to talk about that all. I'm really excited about it. And I hope lots of people come.
Well, based on just that mini intro, you've got me sold. And as honestly, as someone who actually grew up on food bank food, I completely can understand the wanting to relinquish the burden of having to go to the place and sometimes the shame wrapped up in trying to make the decisions. Like I remember being in high school and trying to hide the fact that we were going so that I wouldn't run into the football team. And so being able to have it delivered and someone else focus and that social aspect, I can completely understand from my upbringing why people would prefer this method and why it is so important. And I can also hear and understand that, it's very easy to give money for apples and tomatoes, but not so much the person standing the phone calls, and not everyone thinks of all of the steps that go into it. So I'll be there. That was so interesting. That could have been the whole podcast. I would have listened to everything about vegetables, which is so funny.
It's like finding a dignified way for people to access food, and that might be a non-charitable model. And I think that's what Abby's hinting at, is like a bit of systems change about how we think about all kinds of things. Yeah,
and it connects back to, I felt so connected to Albesa, what you said about, social prescribing is building a movement, and organizing us is, I hope to use the work we're doing to make policy change, because ultimately our program as it is right now is meeting a need in our community, but it's not necessarily a sustainable way that people are getting paid more, having higher incomes, or having ODSP checks be higher, which means that the issue is always going to be there. So if we can find an innovative way to use social prescribing to make policy change, I think that's where the magic will happen. But again, we need to be organized. We need to have a movement, which social prescribing is helping us do. But that's why these conferences are so important too, so that everybody can think about what's going on and be on the same page and make connections so that we can get that work going.
Absolutely. It's all about policy advocacy, trying to move the bar. I completely agree. Albesa, I was excited to hear as well that you've been working with the Alliance on their ongoing Black focused social prescribing project. I would love to hear a bit about that, and also social prescribing at Rexdale Community Health Centre, and how it's helping your center advance their goals with the community.
Oh, definitely my pleasure. Yeah, so we have started social prescribing a few years ago. Actually, at first we had this bigger project that was Healthy Kids Community Challenge, and it was a provincial program. And we had a colleague that brought the idea of social prescribing. She had seen it in the UK, and we just tapped the opportunity to use some of the resources from this project to start social prescribing. And so in the beginning, we started by supporting youth, by supporting families with children and newcomer families that are in our, so it was about providing activities for these families that were new, and really it was a great opportunity for them to create connections. So it was really beautiful. In terms of how it worked when we initially started, is that we had this whole referral pathways with our primary care team. So our primary care providers had a prescription pad where they would have all these lists of activities. And then when newcomer families would go and see them, then as they talked with the primary care provider, they could look at the activities and see what worked for them based on what they were needing at that point. And it was just so beautiful. It was really, really well received. So this is really how it started. And so then after that, we moved on to also a project called Pharmacy. We've been doing a food prescription as part of social prescribing, Abby, and I could hear a lot of the points that you were mentioning. We had the project called Pharmacy, and we were collaborating with Food Share on that, where we were providing fresh fruits and vegetables to our clients, that had issues with access to food. And so what was really nice about, oftentimes we think about like creating this dependency and like, how can we actually empower our clients because we're providing this food, but is that really is it sustainable? Is it helping them long term? And what was really beautiful about a partnership that we created with Toronto Employment Services just in 2021, that's when we started this pilot, is that we collaborated with Toronto Employment Services to link people that were receiving Ontario Works with CHCs across Toronto. So there were 11 CHCs across Toronto, and so the clients would get food support, like they would get a gift card with fresh fruits and vegetables that was worth for 6 months. But at the same time, the social prescribing aspect was that these clients were connected with services that were within the center. So it came from tests to the client getting food support, but then also being able to speak with a dietitian and also get the support that they got from the center. So this is another part of how we've moved on with social prescribing in different ways. And we did this last year, and we're looking for ways to also continue now. Another exciting part of our journey with social prescribing has been the Black focused social prescribing. And we're together on that table with Natasha. It's the project came from Alliance for Healthcare Communities, and the goal of this project is to develop a social prescribing model that is grounded on Black and Afrocentric values and principle. And the focus is to support families with children, so Black families with children. And we are a couple of organizations. It's Taibu, it's Black Creek, Somerset West Community Health Centre. And it's really beautiful because all the organizations bring different strengths to the table as we are starting this new project. And so, for example, just recently we had the training offered by Taibu that was on African well-being model of care. So all of us are working together to really create this model that will serve Black families with children. We're in the early stages, and probably Natasha can even say more to that. We're having conversations, having consultations, focus groups with communities, and really, yeah, it's exciting to see what model we can make through this work. And of course, it comes to supporting families with children, so it's so well received.
Yeah, I'll just say a little, maybe 4 years ago or a little over 4 years ago, the Alliance started with our pilot project. I believe both of your centers were involved. We had 11 CHCs across Ontario that started piloting social prescribing, and a lot of the tools, and we have a guidebook for primary healthcare organizations to implement social prescribing. And so we have all these great tools. And right now the Alliance is working on a social prescribing project for older adults called Links to Wellbeing. So we're trying to get older adults referred to the Seniors Active Living Centers. And then this next project, the Black Focus Social Prescribing, we're looking at some of the great work that came out of our other social prescribing projects and saying, like, how can we make this culturally specific, culturally safe, Afrocentric, and what do we need to do to look at the healthcare system and decolonize it and make it safe for our Black community members. So we're having some deep conversations and some deep thinking. And I would say, I'm sure you would agree, Albesa, like the conversations are amazing because it's really not on the surface, it's going deep. How can we make sure our clients are feeling culturally safe, feeling acknowledged and celebrated in this kind of work?
That's amazing. It was so great to hear all, like, in your list of other community health centers that are a part of this, some of the Catches members as well, that you're all doing such amazing work. And of course, as a Black woman, I definitely feel, that is important to feel culturally safe everywhere you go, especially at community health centers where your primary care or your basic needs are what is part of the conversation. You should feel safe there. And yeah, we've had Somerset West and Black Creek on our podcast before, so they are friends of the podcast, which is very nice to hear. Natasha, I will ask you one last question that was not on the list, so I'm going to put you a little bit on the spot, but just any other final words or thoughts about the conference Thursday and things that you want to say to encourage anyone who's listening who might have time. They might have about 24 hours left to register, and I hear there aren't very many spots left. But if you wanted to give any other insight or highlights into what people can expect on Thursday, myself included, and then we will wrap up the podcast.
For sure. And I will also just mention that the Alliance is launching a new social prescribing project, which is social prescribing for mental health. So we will be having an information webinar this Friday for our members in Ontario who would be interested in becoming a part of that program. So going to the conference, it's coming up on October 20th. We have a full day. So our morning plenary is called Black Social Prescribing for Black Health. And so we have Paul Taylor from Food Share, Paul Bailey from the Black Health Alliance, and Cheryl Prescott, who's the ED of Black Creek, having a conversation about how do we dismantle anti-Black racism in the healthcare system? How do we move Black health forward? And how does social prescribing fit into that? So that's going to be amazing. Cascades is presenting a session on climate change, resilience, and social prescribing with some great speakers. We have our social prescribing student collective doing a presentation. We have a session on social prescribing for older adults. We have our afternoon plenary is presented by the Canadian Institute for Social Prescribing, and it's called Growing Momentums, the State of Social Prescribing Across Canada. We have the value of social prescribing in clinical practice. I'm often asked, like, how do we engage clinicians? How do we get clinicians on board? So we've got some clinicians and one non-clinician who is myself, who will be talking about how do we make this work? I'm really excited about that one. And then we have this is how we do it. And Albesa will be part of that presentation. And Abby's colleague, Carrie, will be talking about this is how we implemented it, because we're also answering a lot of questions. People are like, I want to start. How do I start? Where do I start? Here's how we did it. Here's how you can do it. And then we'll be ending the day with an arts, culture, and well-being community of practice session, which is just going to be just looks very strong and very exciting. And throughout the day, we're going to have some, experiential activities so people can sort of socially prescribe themselves. So opportunity to try a powwow workout based on traditional powwow moves, an opportunity to try West African dance and think about how you could, incorporate that into your work. And our senior center Without Walls will be demonstrating how they do trivia over the phone so that people who maybe are wanting to stay closer to home can still be part of a senior center. And we've mailed out some packages that have like therapeutic coloring and different activities in them. So hopefully people will be able to engage in some of these activities during the day. We really wanted to make the conference, we wanted to infuse it with the spirit of social prescribing and making it fun. We know a lot of our staff have been through a lot in the last 2.5 years. People are working really hard. So we wanted to make this day a bit of a social prescription for our colleagues and give them let there be some fun in it as well.
Sounds amazing. I will be registered as soon as we hang up because it sounds awesome. I mean, I was sold on the food and then powwow and West African dance. Like now you're speaking to me personally. I will be there.
And so people can register on the Alliance website, which is alliance.org, and just go to the Social Prescribing Conference, and it's a sliding scale registration. So there's still a few spots left.
Perfect. You already segued into my next question. Of course, it's alliance.org for any other information as well in terms of what the Alliance is doing. Abby, would you like to just shout out how anyone could learn about Guelph and about the food social prescribing that you are doing?
For sure. So the Seed has an Instagram account and a website that's easily Googleable. I don't know that a full thing right now, but you can find, we have some published academic reports on food prescribing if you want to give those a read. And then the Guelph CHC's website is guelphchc.ca. and you can find out more about the Guelph CHC there.
I believe it's theseedguelph.ca.
Yes. Okay. Thank you.
No worries. That's my job. And Albesa, if you wanted to shout out Rexdale Community Health Centre and how anyone can learn more about the amazing work you're doing there.
Absolutely. And we just have a fresh website that we have relaunched recently. So definitely it's www.rexdalechc.com. And what's really good about the website is that it really enlists all the programs that maybe I could not mention in detail. Clients can now also book appointments online as well through our website, which is really flexible. So I would definitely leave that there. And then we also have an Instagram handle. It's RCHCY&FS. So it's Youth and Family Services. So that's a lot of the programs that would be posted there that are part of our Youth and Family Services.
Wonderful. I want to thank the three of you for taking the time to talk to me about this today. I feel so inspired and excited. Every time I do this podcast, I learn something new about the community health center model and what's going on that I had no idea about. So I feel inspired. I will be there Thursday. I hope anyone listening has the time to do so. And if not, that they've learned more and have some takeaways and go and expand their knowledge about social prescribing, because it sounds like hopefully a new wave, a new policy and advocacy for reducing barriers, which is what we're all trying to do in our own organizations. Thank you guys so much for being here today.
Thank you so much, Hillary.
Bye. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.